Okay, so here we are discussing the abdominal wall. So basically, we have two muscles: the anterior we have the rectus abdominis, and the posterior we have the quadratus lumborum. And the remaining abdominal muscles consist of three layers, which moves from posterior to anterior. Uh, to the lateral margin of the rectus sheath anteriorly, each layer. So basically, we have the posterior, the quadratus lumborum, and anterior we have the rectus sheath. So the other runs between these two. So each layer is muscular posterolaterally and eponeurotic anteriorly. So posteriorly they are, you will see in the further diagrams that posteriorly they are muscular and anteriorly they are eponeurosis. Is firm but elastic and consists of 8 layers. So we have skin, superficial fascia, and external oblique muscle eponeurosis, and internal oblique muscle and eponeurosis, transverse abdominis and eponeurosis, and fascia transversalis, extraperitoneal tissue or extraperitoneal fat, and then we have the peritoneum. Okay, so this is the whole anterior abdominal wall. So further we have these abdominal wall muscles. So as we know that the most important and prominent is the external oblique, which is, then we have the internal oblique and transverse abdominis, rectus abdominis, and pyramidalis. So we have here their origin, and then we will study the insertion and the. So origin of external oblique is from muscular slips from the outer surfaces of the lower 8 ribs, means from 5 to 12. If you see, it will be running from 5 to 12 ribs, and then also inserts on the interior. So this is the origin. So insertion is lateral lip of the iliac crest, or you can say the interior half of the iliac crest, and the aponeurosis ending in midline raphe linea alba. So anteriorly they insert on the linea alba, and above it's also inserts into the xiphoid process. So this compresses abdominal contents, so helps in generating the abdominal pressure. Both muscles flex trunk, also can flex the trunk flexion, and each muscle, for example interior bending, each muscle bends trunk to same side. Okay, so left side external oblique will bend the muscle to the left side, trunk to the left side, so turning anterior part of the abdomen to opposite side. Internal oblique arises from the thoracofacial thoracolumbar fascia. So if you see on the sides of your body, so drip to external oblique, there will be thoracolumbar fascia, the main fascia. So the internal oblique will arise from the thoracolumbar fascia, iliac crest, between the origin of external and transversus, and lateral 2/3 of the inguinal ligament, and lateral 2/3 of the inguinal ligament. So it will insert to inferior border of the lower 3 or 4 ribs, and aponeurosis ending in linea alba, and then pubic crest, and then we have the pectineal line. So on the pubis, the insertion is on the pubis, specifically on the pubic crest and the pubic line. And A is for the external oblique anterior rami of lower 6 thoracic spinal nerves, T7 to T12. Same is for this as well, T7 to T12, and L1. 8 L1 with anterior oblique, internal oblique as well here. It also compresses abdominal, helping in raising the abdominal pressure, and also flexes the trunk. Each muscle bends the trunk and turns anterior part of the abdomen to the same side. So transverse abdominal system also arises on the thoracolumbar fascia, a medial lip and of iliac crest. So lateral 1/3 of the inguinal ligament, and costal cartilages of lower 6 ribs, from 7 to 12. So this arises from the costal cartilages. Okay. So aponeurosis ending in linea alba, mainly it inserts into the linea alba and the fibers are transferred. Okay, and a pubic crest and a pectinelli. Okay, listen. The most important thing is the direction of the fiber. So external oblique goes downward and forward and medially. The internal oblique is go upward, forward and medially. And the transverse abdominis fibers are transverse. And anterior eye of lower 6 thoracic spinal nerves, same, and L1 as well. And compresses the abdominal contents mainly. So we have the rectus abdominis. So it arises from the pubic crest and pubic tubercle and the pubic symphysis, and costal cartilages of the ribs 5 to 7 and the xiphoid process. So lower costal or the costal cartilages of the ribs which form the costal margin, for example 6, 5, 6, 7, and xiphoid process, and the same supplies T7 to T12 as for the external oblique. Only the internal oblique and transverse abdominis has L1, and it has the same function that compress abdominal contents, flex vertebral column, tense abdominal wall, and it gives you the famous six packs. Pyramidalis is the front of pubis and pubic symphysis, and so into the linea alba, it inserts into a linea is a small muscle exactly with the origin of the this rectus abdominis. So it inserts into a linea alba and anterior ramus have T12. Only anterior ramus of T12 supplies it, hence the linea alba. Sometimes it's absent. What are the blood supply of external and internal oblique muscles? So external oblique, lower posterior intercostal arteries and subcostal arteries, deep circumflex iliac arteries, and the superior and inferior epigastric arteries. So these are the blood supply of the external oblique. Same for internal oblique is lower posterior intercostal arteries and subcostal arteries, superficial and deep circumflex iliac arteries, and the superior and inferior epigastric artery. So the deep circumflex iliac artery arises from the femoral artery, is a branch of femoral artery, and the superior epigastric artery is a branch of internal thoracic artery, and inferior epigastric artery is a branch of external iliac artery. And here on the internal oblique side we have this, the superficial and deep circumflex. So superficial is from external iliac artery and deep is from femoral artery, and superior and inferior epigastric arteries. What is the blood supply and function of rectus abdominis muscle? So blood supply mainly comes from the superior and inferior epigastric arteries, lower 5 posterior intercostal and subcostal artery also gives contribution, and function is to flex the vertebral column and also tenses the abdomen. At which plane the neurovascular bundle lies between internal oblique and transverse abdominis. Okay, and these are the layers. You can see we have the external oblique, and then we have the external oblique and the internal oblique and the transverse abdominis and the transverse fascia, the extraperitoneal fate and the parietal peritoneum. This linea alba in the center, superficial fascia membrane. Okay, so I remember this as we know that A, B, C. So C comes first. So we have the camper fascia fatty layer, and then the scarpa from S is the deep membranous layer. So these are the, we have here the rectus abdominis muscle, which starts from the pubic tubercle, pubic crest and symphysis pubis. So goes up to the lower 3, the costal cartilages of the 5, 6 and 7 ribs, and the xiphoid process. So here is another diagram as well as the atlas. So here we have this is the internal oblique, hit this one, and we have this umbilicus, and the rectus abdominis in the center on both sides, and we have the scarpa fascia and camper fascia here, labia majora, and we have here the external oblique. So external oblique, you can easily identify this. The external oblique always form here the inguinal ligament. So you can recognize external oblique by this trick as well. Here it's the reflected. Here the external oblique is reflected. This and this. Okay, so how are anterior and posterior rectus sheaths formed? So we have at the level of the xiphoid process, all the layers go the okay. So here there is another here they mentioned only the below the arcuate line and above the arcuate line, but there is still one level. Sometimes some books mention that there is another level like way above the umbilicus. So we will try to figure out that what structures are at those levels. So okay, so first read we above the arcuate line. So above the arcuate line we have the external oblique and the internal oblique anterior layer only, because it splits. For example, this is your external oblique, here is your rectus abdominis. Your external oblique will go in front. Here is the linea alba. The internal oblique here, this splits into two, one interior layer and one posterior layer. So this anterior layer goes interiorly and posterior layer will go posteriorly. And then we have the transversus abdominis posteriorly, and then the transversalis fascia, so on. So this is above the arcuate line. Below the arcuate line, what happens that we lose the posterior layer. So what happens that below the arcuate lines, and let's suppose we have the this below the arcuate line, what happens that external oblique here, this is the rectus abdominis, this is the another one, and the external oblique goes like this on both sides, and the internal oblique also goes on both sides. Okay, and the transversus abdominis also goes on both sides in front. Here we have only the transversalis fascia. So the rectus sheath, external oblique, internal oblique, and transversus abdominis go in front, and the posterior layer is absent. So we have only the transversalis fascia. So this is the difference, and this is very important. And what I was telling you, that there is one other level as well, and that is the level of the above the costal margin. So if you look above the costal margin, so we have the external oblique only in front and nothing else. Posterior we have the ribs 6th and 7th costal cartilages and the xiphoid process, and only anteriorly we have the external oblique muscle sheath. So this is about the so what is inguinal canal? So we are going to discuss in the next video.